Hi, I'm Dr. Stephen Dominguez. I'm an aesthetic plastic surgeon practicing here in Huntington Beach, currently coming to you from the Huntington Beach Surgical Arts Center. I practice aesthetic plastic surgery, which means I work more in beauty, aesthetics, than in function, like reconstruction, which I used to do. I've published many surgical articles in plastic surgery and in head and neck surgery, and I've written chapters in textbooks on plastic surgery. My practice is currently aesthetics, which means facelifts, eyelids, smile lifts, neck lifts, liposuction, liposculpture, tummy tucks, breast augmentation, breast lifts, BBLs. If it's aesthetic in nature, I'm your guy, and I want you to come and see me here at Huntington Beach Surgical Arts. So I've been in practice since 1988. So I've trained at UCLA, the Cleveland Clinic, and UC San Diego. I've been on faculty. I've written multiple articles in surgery and plastic surgery, and I've also written textbook chapters on trauma, facial trauma, and in mesenchymal cells or new biotechnology. My research interests have been since 1984, when I did research on what we now know as mesenchymal cells or stem cells back at the University of Iowa. So I still continue to do research at UCSD. Like I said, I just published the most recent paper was 3 years ago. We've got a couple more on breast augmentation and advanced flap work with individuals who undergo tummy tucks. So when someone is looking for an experienced physician, I think I qualify based on age and experience. When someone wants an academic-based physician, I qualify both, and I'm in the aesthetic field, and I'm currently a leader in fat grafting and mesenchymal cell use in the aesthetic realm. Good question. You know, when I was a medical student at the University of Iowa, I was in a program that was MD PhD, and my PhD work was in mesenchymal cells. And unfortunately, that year of research did not produce a paper because of variable factors. In my third year rotation, I excelled in head and neck surgery, and I decided that's what I was going to do. So I matched the Cleveland Clinic in head and neck facial plastics, and liked it, published, came to UCLA, went to Northwestern, and now I'm at UCSD. And I'll tell you, plastic surgery is a wonderful field. The aesthetic component of it is even more wonderful because it incorporates everything except reconstruction, but incorporates the beauty in the individual that doesn't have trauma. So that's what I do. Well, you know, plastic surgery has never really been dangerous in the right hands. So the danger lies in the whole process of setting. And the process of setting requires a good communication between the patient, patient's family, and the physician. What does that mean? As a physician, I have to make sure that when I interview somebody, that they have a realistic expectation, both when they walk in and most certainly when they walk out. My obligation is to examine the patient. Does this patient qualify for the surgery that they're asking for and or which I intend to do? The post-op care is equally as important. It's not just cut, sew, and go, but it's cut, sew, and reevaluation to make sure the healing process is as appropriate. The selection of the center is also important. Am I going to operate with individuals in anesthesia and nursing who are qualified? For instance, when we do a bariatric mummy makeover or tummy tuck, that individual should have a critical care-based anesthesiologist. Not an anesthesiologist that works, you know, in colloquialism, but someone who understands critical care. Because these patients, bariatric ones, have fluid shifts. May not be volume loss of blood, but the fluid shifts. So things we need to look at is, you know, are the fluids shifting? Mostly people have diabetes, high blood pressure, some kidney issues. All that needs to be considered by the anesthesiologist. So again, safety is in the process that's inherent in plastic surgery. So if you feel that you need that level of care, you should definitely see me here at Huntington Beach Surgical Arts so we can appropriately evaluate, come to a consensus of what is safe for you, and then proceed. So here in 2022, what one reads about happening with adverse events is typically done like, for instance, a very large, greater volume loss of fat, which should not occur today, or individuals who lay on the table for a long period of time and have blood clots that start in the legs and go up into the lungs. That should not occur today. Or individuals who have massive fluid shifts end up, having a stroke or a heart attack. That should not occur today. So again, safety, come to a good place like this, talk to me, talk to my colleagues, I want to make sure we take care of you and mitigate those risks for you. That's what I believe in 2020 should be the process. Yeah, so that's another good question. So there are many in-house shops where physicians can have their own surgery centers. Yeah, if you go to the state board, the physician can perform surgery, minor surgery, local surgery, conscious sedation surgery, or awake surgery in their own offices and or other centers. My practice is a little bit more on the side of bariatrics, advanced plastic surgery, and I feel more comfortable working in a center that's accredited and a center that has the anesthesiologist and nursing staff that's going to mitigate any and all risks as best as we can so that the safety of the patient is number one. So I don't perform in-house surgery in my office, although I could by law, and I don't perform surgery in non-accredited centers because that's just not my policy. So coming to Huntington Beach Surgical Arts is definitely the place to be. You know, I'd like for you to come to the Huntington Beach Surgical Arts website and take a look at the before and afters. I think it'll give you a good idea of what I can do for you and your needs. But the best thing is to call, schedule an appointment, and let me come in and actually examine you, talk to you, and reach a consensus that's going to be mutually beneficial for you and satisfying for me. So, looking forward to seeing you soon.